United Nations agencies say a quarter of the population in Gaza is facing starvation. The Israeli military says aid trucks are getting through, but distribution is a problem. That contradicts what some aid agencies are saying, however. They claim that the military is stopping trucks from getting in. CBS News has not been able to verify either claim. Dr. Paul Spiegel joins us now. He worked with a UN agency in Cairo to support the public health response in Gaza. He's also the director of the Johns Hopkins University Center for Humanitarian Health and a distinguished professor at the school. Dr. Spiegel, thank you for being here. Talk to us about your work in the Middle East and the challenges that you faced outside of Gaza.
Sure. Well, thank you for having me. Yes, I was working with various UN agencies, including the UN Relief and Works Agency. The challenges were extraordinary because you have a very small space. People are crammed together with insufficient shelter, water, sanitation that are barely meeting survival needs, and in fact, in some situations, are not. And they are being bombed even when they're told that they're safe areas. And so we were working on various scenarios to see what will happen in case there is a humanitarian pause, or what happens if the bombing intensifies, particularly in the south. We were also working and we're sadly waiting for a big infectious disease outbreak. And the response to that is going to be extremely difficult because there isn't enough humanitarian space, meaning we're not really allowed or able to operate. And there's just insufficient water, food, and medicines.
And we know that that is such a likely possibility given all of those factors. Dr. Spiegel, as you were working with people who were trying to maintain medical care within the Gaza Strip, what did they tell you about the situation?
They are devastated in many ways. They can't believe that this is happening and that it's been happening for so long, and yet there has been insufficient aid being allowed in. I've never really experienced this so closely, where we're working with doctors and nurses. They're trying to do their work, but at the same time, they themselves have been displaced multiple times. They have to wait in long queues to get food and water. And then they're also dealing with family members that have been either severely hurt, burned, and or killed. And so they're trying to continue to deliver services in an extraordinary difficult situation.
I want to pick up on something that you just said, Dr. Spiegel. You said you've never really experienced anything like this before. I know that you've responded to several international crises, including Afghanistan and Ukraine. How else is this situation in Gaza really different from other humanitarian missions that you've been on?
Every situation is unique and it's context specific. What I would say is quite different here is, number one, people are not allowed to leave. And so in many other situations, people can move within a country. In this case, Gaza is so small. So they can move to a safe area and or they can leave the country. And that's just not happening here. So people are not able to leave and the bombing is continuing. And then secondly, there at the beginning was a siege where no food and water and medicines were allowed in. And now there is some that coming in, but it's completely insufficient. And therefore the ability and the humanitarian space to respond is not possible. And then lastly, well, it's not new. The healthcare services, the hospitals and many health centers are being actively attacked and bombed, and therefore the amount of care that is available is reducing on a continuous basis.
Dr. Paul Spiegel, thank you for bringing your insight.